Just gonna sort the lightning. Good. Normally by this time my life is supposed to have ended though. But we're just starting. Let's see who's online. I think there should be a topic. Hello, Nasima. How are you doing? Trust you are doing great. We are starting the live very, very late today. We are starting this live very late today. Normally we start about 9-ish, 10 o'clock, but it's past 10 and I decided to breeze in. Hello, Ima. How are you doing? Trust you are doing great. If you're on this live section, kindly drop on the comment section where you're watching from. Kindly let us know where you're watching from. All right. Thanks for joining the live. It's more or less like a question and answer section. See, I'm able to pinpoint a particular topic to talk about today. So if you have any questions to ask me, kindly drop on the comment section while I think about what to talk about. Hello, Cynthia. How are you doing? Trust you're doing great. Welcome to our live today. Do you have any question for us? Hello, everyone, and welcome to Nurses Lecture Room YouTube channel. All right, if this is the first time of coming across this channel, my name is Mercy Mary. I am a registered nurse midwife. Feel free to subscribe to the channel. On this channel, we talk about health. We talk about those things you're scared to ask your doctors and those things that your doctors don't really have the time to talk to you about. That is what we do on this channel. For the now, I'm just doing the question and answer section till we get a particular topic to talk about tonight. So just let me know if you have any question on the comment section. Kindly let me know if you have any question in the comment section. And if there's a particular topic you would like us to discuss in details, kindly drop on the comment section. For the now, I'm trying to check the questions on my YouTube channel to pick a particular topic to discuss tonight. But if you feel there's a particular thing you want us to talk about, kindly drop on the comment section. Ona Ifeanyi, welcome to Nurses Lecture Room Live. Okay, drop your question. I am waiting for that question. That's why I'm here. All right. Ona Ifeanyi, I'm waiting for your question. Okay. Hello, Gordon. How are you doing? Trust you are doing great, Gordon. I'm waiting for your question, Ifeanyi. And if there's anybody that has question, feel free to drop the questions in the comment section. I am willing and ready to take all the questions tonight before we talk about what I have to talk about today. Right. Solitude No Mercy said hi. Solitude No Mercy, how are you doing? And trust you are doing great. We have Richie. Richie, hi Ima. I'm new here. Welcome to our YouTube channel, Ima. Richie, I mean. So all you have to do, if this is the first time of coming across our YouTube channel, my name is Mercy Mary. I am a registered nurse, but I'm currently practicing in the UK as a registered adult nurse. On this channel, we talk about health. Those questions you are shy to talk to your doctor about, bring them and we are here to help you out with it as much as we can. And those questions that your doctors might not have the opportunity to talk to you about, we talk about it here. All you need to do is to subscribe to our YouTube channel, turn on that notification bell just in case we pop up any new videos or we are going live. You are first on the list to rush down to join. So tonight we are going to be talking about sexually transmitted infection. But for the now, I'm taking questions. We're going to be talking about sexually transmitted infection, and that live section is going to be starting by 11 p.m. where we're going to be talking about STI testing, how STI is being done, when and why. That particular section is going to be starting by 11 p.m. So it's like 30 minutes from now. That is when that live section is going to be starting. So if you have any question before that live section, I would advise you to drop your questions in the comment section. And Omar, I am waiting for your questions. Ona, Ifeanyi, I'm waiting for your question. Feel free to ask your questions in the comment section. The main live is going to be starting by 11 p.m. Okay, Cynthia has a question for me. Cynthia Ayango said, what can you do if the baby is getting difficult to get for a long call? So Cynthia, I think you should read your question again. Please read your question again. It's not cleared. You said, what can you do if the baby is getting difficult to go for a long call? So sorry, I think Cynthia should read her question again. It's not clear. Okay. So Vero, how are you doing? It's nice having you on our live today. Thank you for joining today's live. If you have any question, feel free to drop on the comment section, Vero. All right. We started late actually today, but the main topic we're going to be discussing today is sexually transmitted infection, how, when, and why. And we're going to be starting that particular live section by 11 p.m. It's going to be from 11 p.m. to 12 p.m. Okay. Okay, someone is asking, like, thank you, please, what are the benefits and side effects of M2 tone capsule? I don't really know much about M2 tone capsule, but I heard that it helps to regularize period and it also helps to control heavy bleeding. associated with your monthly cycle. So I don't know in details about it, but I know it goes a long way to help with your period. It helps to regularize period. For those that are having irregular period, they can take the M2 tone capsule. But before you do anything of such, like I will always tell you, always consult your doctor for proper checkup for them to know what to do. So M2 tone capsule, it helps with your reproductive health from what I heard, but I am not familiar with the tablet. I'm not familiar with the capsule. I've not used the capsule, and I don't have someone that I've used the capsule, but I heard it helps to regularize the cycle. It helps to regularize your period and is generally good for your reproductive health. So I don't really know what it is made up of. All right, Vero, I think your question. Okay, Vera, I guess your question has been answered. So we have Fury. How are you, Mary? I'm fine. How are you doing, Fury? Then we have Rashid Ame. How are you, madam? I'm fine, Rashid. We have Gary Shofanari. How are you doing? And trust you are doing great. If this is the first time of coming across this channel, my name is Mercy Mary. I am a registered nurse midwife, but I'm currently practicing in the UK as a registered adult nurse. Feel free to subscribe to our YouTube channel and turn on the notification button. On this channel, we talk about your health, we talk about general health, but this is a big disclaimer: for any personalized healthcare, always consult your doctor. For your personalized healthcare, always consult your doctor. This is more or less like a general health education, like a general advice, but not a one that is personalized. Okay. Okay, Vera said, thank you. Yes, please. I got it from my doctor. Okay, that's good. You can keep up with the medications. That's good, Vera. So we have a Benny's baby. Benny's baby, good evening. Good evening, Benny's. How are you doing? Trust you are doing great. Then we have Isa Zachary. Hi, doctor. I'm a nurse, not a doctor, please. He said, hi, doctor. Good evening. Please, what exactly time for your life daily lecture? Because I don't want to be missing up. I just came in now. Isa Zachary, my life usually starts between 9 to 10. But today I actually came late. I started late because I had a lot of things I had to clear up. I have some things I had to clear on my decks before coming live. So today's live generally is going to be starting by 11 p.m. We are going to be talking about sexually transmitted infection by 11 p.m. So this is more or less like question and answer section before the main live section. So the main live session today is going to be starting by 11 p.m. But outside today, from tomorrow, we'll go back to our normal time of 9 p.m., 9 p.m., a.m., 10 p.m. That's when we normally do our live. I believe that is okay, Zachary. So we have Mike Kinat. Mike Kinat, how are you doing? Trust you are doing great. Welcome to Nurses Lecture Room. If you have any question, feel free to drop on the comment section. So by 11 p.m., feel free to go grab a coffee, grab a tea, depending on the weather around, grab some cold drinks, depending on where you are and the temperature around you at this time of the night or at the time of the day. The main life is going to be starting by 11 p.m. and we're going to be talking about STI testing, which is something I believe everybody, whether you are sexually active, you are just curious about your sexual health, it's very important for you to be here by 11 p.m. So Zachary said, my wife had her last period 15th of last month, and we are expecting it any moment from now. So how do we do about conceiving? Like I earlier said, I think Zachary, you've asked this question in our previous live sections. I said to get an accurate of your wife's ovulation cycle, or of your wife's ovulation day, we have to have at least 3 start dates of her menses. So you know the one for last month, so we need the one of this month. If we know the one of last month and this month, we can just try and see what we can do, but we need at least 3 start dates to actually be more accurate. With 2 start dates, we might not be accurate because it might not, like, if you have 3 start dates, it is much easier to say, okay, there's a possibility that this is correct, this is not correct. But with 2 start dates, it's not usually accurate. So what our advice is, wait for your wife's period that is starting this month and give me the date. So when the period starts this month, I'm going to be live. You're going to see me and we're going to try and see what we can do to actually sort it out. So we have Chisom Anozie. Hello, Nurse Mercy Mary. Good evening. Happy Sunday, but happy Sunday, Chisom. How are you doing? And trust you are doing great. It's a beautiful evening over here. And do you have any question for us? And if this is your first time of coming across this YouTube channel, my name is Mercy Mary. I'm a registered nurse midwife. Feel free to subscribe on our YouTube channel, turn on the notification bell, just in case we pop up any new video. You get the notification and you come and join us quickly. All right. So, but our live for today is going to be starting by 11 p.m. We're going to be talking about STI testing. STI testing. I believe if you are watching this live, you know what STI means. So we're going to be talking about STI testing. But now we are doing the question and answer section while I prepare for my live. Chisom, it's nice having you here. So if you want to know about STI testing, how is it done? Stay on and wait till 11 p.m. By 11 p.m., we're going to be starting a fresh live where we're talking about STI testing. Oh, we have a lot of questions. All right, so I'm going to be taking these questions one at a time. So we have a question from Chisom Anazie. Yeah, I have a question. My husband has been complaining to me. One, he said he has taken so many worm medication and it is not working. How does he know he has worm? Is he passing worm? Like, is worm coming out from his poo? Why does he feel he has worm and he needs to deworm? Because you don't have to continuously deworm regularly when there is no need for it. So I don't know if I get your question right, Chisom. I don't know if I get your question right. If I got your question right, sorry. Because your husband has been complaining to me to deworm. He said he has taken so many worm medication and it is not working. First of all, why does he feel that there's a need to deworm? Because it's not even good for you to be deworming every time. It's not good. It's not good. So what I would advise him to do, since he feels there is worm, he has been deworming, it might just be more than the worm. He should see a doctor and get useful guidance. That's what I would advise from my own point of view. So we have Baba. Hi, Mary. Kate from South Africa. I am 33 weeks pregnant and have a BP reading of 157, 129. Should I be consigned? Personally, I would say yes, you should be consigned. That is why you should speak to your doctors and also your midwife in regards to this blood pressure, because the normal blood pressure range is between 120 to 140 milligram mercury systolic. So now you're having 157 systolic. I'm not saying you should be tensed, but with the high blood pressure, it is something you will need help with from your midwife and also from your doctors. You understand? You have to be on close monitoring. You have to be monitoring this blood pressure regularly. And if there's a need for the doctors to actually put you on some antihypertensive medication during the course of pregnancy, they might look for a suitable antihypertensive to help. Because an increase in blood pressure, that's when you start hearing something, that's when you start hearing things like eclampsia, pre-eclampsia, and things like that. So what I would advise, if your doctors or midwife are not aware of this blood pressure reading, and this blood pressure reading has been consistent with the pregnancy, what I would advise you to do is to actually see the doctor, see your gynecologist, see your midwife, and get it sorted out. Okay, that's what I would advise you to do, Vavakati. Varakoshi said, please, what are some of the causes of warts around the neck? Warts around the neck. That question I can't really provide a direct answer for. Vera, I can't really provide a direct answer for that question. Okay, Vava. And also, what's Vero, have you seen the doctor in regards to those words? Have you ever been like, have you checked if there's HPV? Have you ever heard of something called HPV? Have you seen a doctor and they checked if there's any HPV related things? Because what's HPV, they are kind of very related. Yeah, they are brothers and sisters, I would say. So Chisholm Anoze said he has been feeling uncomfortable for weeks now. He cannot visit the toilet. His stomach is getting bigger. And according to him, he's always feeling hot inside of him. Chisom, my personal advice to you is for you to go and see the doctor. Yeah, that's like that symptoms are really worse, and it's something he has to see the doctor about. It's not like warm issues. The stomach is getting bigger. Like you said, it's not the same size. Or like if the stomach was getting bigger gradually, like little by little, but now you said the stomach is getting bigger. So it's obvious that there's a change in his abdomen, there's a change in his stomach, and he's feeling hot on the inside, and he has not been able to pass through. So what I would advise you to do is to go and see the doctor. Please and please go and see the doctor. Book an appointment with your doctor and see your doctor for proper examination, just to find out what the cause is. So that's what I would advise you to do. So Chinazal Cynthia, hi nurse. Hi Chinazal, how are you doing? Trust you're doing great. Cynthia said hi. All right. Chisom said, all right, thank you, ma. You're welcome. Where is Vero? Did you get what I said? Because warts are usually caused by HPV, which is the human papilloma virus. So if there is warts around your neck, I'll advise you to see the doctor too. And if it's someone you know or it's you, things like that can be spread skin to skin. Yeah, it can be spread skin to skin. So it's better you avoid contact. If it's you, avoid contact with people. And if it's someone you know, avoid contact with that person, and also encourage them to see the doctor and avoid contact, because HPV can be transferred skin to skin. Vero, okay, it said, but this particular one, they said it comes natural and doesn't have any medical effect. I don't know about that particular one, but I know warts are generally caused by HPV, and this one can be transferred skin to skin. So try as much as possible just to be on the safer side, to avoid like sharing towel with that person, getting in contact with that, especially when you have a cold too. So that's what I have to say personally. So Chinaza Cynthia said, nurse, I don't see my menstruation, though I have seen a doctor, but he said it is normal since I was on a family planning injection. But I've stopped it since March, but till now, I have not seen it. So everybody reacts to family planning differently. Some people stop a family planning method, and the next month, they start seeing their menses. Why others, they stop a family planning method and it takes some time for their menses to come back. So you stopped in March, January, February, March, April, May, June, and we're in the month of July. So what I would advise you to do, if you want to get pregnant, if you are trying to conceive, if after waiting for like 5-6 months and the menses is not coming by, I will advise you to see the doctor again. Because everybody, like I earlier said, reacts to family planning differently. So there are some people that are on pills, they take pills daily. Immediately they miss one day of that pills, they get pregnant. And there are some people that will miss several days and nothing will happen. So that's just how dicey it can be. I don't know if I'm making sense to you, Chinaza. So we have like 11 minutes for the second live section to start, where we're going to be talking about STI testing. Very important. Okay, I think we have a question for Vero. Please, is skin tags the same as what? No, skin tags are not the same as what. They are not the same. They are two different things entirely. One is soft and one is rough. One is fleshy and one is hard. So it's like two different things entirely. So Chisholm said, I treated PCOS last year and some other stuffs because I was not seeing my period frequently. There are some changes, but my menstrual cycle has not been balanced. It's either 28-day cycle, 35-day cycle, or 40-day cycle. You treated it last year. Immediately you started treating it. Was the cycle regularly? Was the cycle coming regular, or it came regular for some time and automatically it stopped again and started again? Because generally PCOS can be managed. It cannot be totally treated. It can be managed. PCOS can be managed. So if you are trying to conceive, it's advisable for you to continue with that treatment, or you go back to your doctor and tell them how far you've gone with the treatment and what you are experiencing at a particular moment. Tina said, thank you so much. I really appreciate. We have Esther Olem. Good evening, ma'am. Please, I'm having heavy bleeding for the first 2 days. My period lasts for 4 days. Having heavy bleeding for the first 2 days, and after and the next day it's it's normal. I don't think it's anything of concern. It's heavy bleeding. People there's people that have light bleeding. There's people that have heavy bleeding. But you said for the first 2 days it is heavy, then the last days are perfect. So I don't think it's something you should be concerned about. Please, any causes of skin tags? Skin tags can be caused by age. As one age, the skin also changes. Friction, like when your skin is coming in contact, like there's a friction, that can also cause it. Genetics, like genetic predisposition, can cause skin tags. There are some medical conditions that can also cause skin tag. Obesity can cause skin tags. Pregnancy can cause skin tags. Diabetes can actually cause skin tags. HPV can cause that skin tags. Then high cholesterol can also cause it. So you can look into that and check around if that is related to anything that's causing your skin tags. Chisamanu said, no, I usually see my period once in 3 months, and sometimes while menstruating, it lasts for more than 15 days. That's a lot. Chisam, I would advise you to see the doctor, because your normal that's to show, first of all, from you seeing your period once in 3 months, and also for when the period comes, it lasts for 15 days. It shows that your cycle is not normal, it's not regular. There's something wrong somewhere. So what I would advise you to do is to see the doctor. Yeah, is to see the doctor. The cycle is not regular. It's not normal. Probably there's PCOS, like you earlier said, you were treated for, I think you said you were treated for PCOS. Yeah. So what I would advise you to do is to see the doctor. So why seeing those doctors and why undergoing some different medications, taking your drugs, A healthy lifestyle goes a long way to help. When it comes to PCOS, when it comes to this general body, a healthy lifestyle goes a long way to help. What you eat, what you take in, all goes a long way to help. These days, there's an increased rate of PCOS, there's an increased rate of infertility as I speak. So what you take in is going to go a long way to help. If you know this Coral Beauty sisters, Nasi Ume, I think it's Nasi Ume that's her name, and she had talked about her journey having PCOS and how she started living a healthy life, like how she started living a healthy life from the pots she used to the food she take in, like she makes sure everything is healthy, and she emphasized on the impact of healthy living as this plays a role to help with the general health. So she emphasized on it because she once had PCOS that she had to deal with. So what you take in generally goes a long way to help you with it. So it's not just about taking the medications. Why taking the medications being prescribed by your doctors? Having a healthy lifestyle will go a long way to help. So that's what I have to say, Chisom. And it's very important for you to see the doctor, especially when you are want to conceive. Not just any doctor. Yeah, when you go to the hospital, you see different types of doctor. You have to be peculiar, like you have to be specific about the doctor you want. You want to see an O&G doctor, maybe an or obstetrics and gynecologist, or you want to see a fertility doctor or a woman doctor. Be specific with what you want when you go to see them. They should not just give you a general surgeon or a general doctor to deal with, like to attend to you when we are talking about how you having irregular menses and irregular cycle. You need a specialist, you need a fertility expert to actually deal with you. All right, not just, so what I advise, like back then in Nigeria, we have different hospitals. I am trying to like remember what's happening in Nigeria. We have different hospitals, and these hospitals sometimes are owned by like general surgeons and all that. So there are some hospitals that you know the owners are actually in charge of women's health. The owners are like they do a lot of women's health, like maternity, delivery. I think those hospitals are more in much more better than just going to doctors that don't actually deal with women. They might just try and see what they can do. They might not prefer the best solution. So the best thing is to look for the doctors that deal with women, the doctors that deal with fertility, the doctors that deal with reproductive health to actually tackle that situation so they don't start guessing and trying to treat. That's why I advise always see a specialist when it comes to your body. So I'm going to answer Esther's questions, and I'm going to come back because I said I was going to start the next slide by 11 p.m. So it's just 3 minutes. So Esther is the last question I'm going to take now. Then if you have any question, join our live by 11 p.m., which is starting in 3 minutes time. And after the section, you can ask your questions. So Esther said, please, ma, my period sometime month 27, 28, 26, 25, 30. Please, ma, is it normal? Yeah, it is. It is normal. It's okay. So there are some things that can actually affect your period, like make the dates fluctuate a little bit, which is stress, the drugs you are taking. Sometimes if you take some malaria drugs, sometimes if you take some paracetamol, ibuprofen, like drugs generally has a wrong way to play, like in your general body as a woman. So this can actually alter your menses in one way or the other. So if your body is stressed out, if you're on medications, those things can actually alter your menses with some days, delay to some days, or make it come earlier than the other. I don't know if I'm making sense, Esther. Let me know if you get the answer before I end the live. So okay, I'm gonna. I said I was going to answer Olem's question last. Chisholm said I was placed on Evelyn Primrose, Overcare, Gabagoline, Metformin. Metformin is diabetes related for 3 months, and the doctor I met was a female gynecologist. I also did scan, and I was told there were some follicles in my ovaries. Since you are on treatment and the doctors are giving you the best medications, I would say, since you met with a female gynecologist, I will also advise you work on healthy lifestyle. That's my personal advice. Work on healthy lifestyle, eating healthy, staying healthy, avoid caffeines, avoid alcohol, avoid smoking, avoid any environmental factors. So I'm going to end this live now because we're starting the live. The live is supposed to start by 11 and it's 11 now. So because I can't actually edit the title of this particular live. So all you have to do, I'm still online, but I want to start the live again to put the title, what we're supposed to be discussing today. So if you have any question, I think you should bring it to the other live that will be starting now. So I'm going to end it and start again where we'll be talking about XTIs. All right. See you in my next live, okay? You're welcome, Esther.